Hello, this is Dr. David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is an overview of failed back surgery syndrome. Failed back surgery is when the outcome of low back surgery fails to provide the desired outcome. The result is chronic pain, which is termed failed back surgery syndrome, otherwise known as FBSS. It's one of the most frustrating things a patient can deal with since he or she went the surgery route hoping for a pain-free outcome. Studies show that up to 40% of all back surgeries fail within a few years. 10% of back surgery patients actually end up worse than they were before the operation. Each additional surgery that is performed has a lower chance of success than the one before. All in all, it can be an exceptionally depressing situation. Now, how does it occur? Why does it occur? There are a few different reasons. One is surgery can be performed for the wrong reason. 50% of board-certified, fellowship-trained, yada yada spine doctors get the diagnosis wrong as to why a person's back pain is occurring. It's just the modern medicine hasn't caught up with back pain as it has with other areas of medicine. The other reason is that surgery could be performed for the right reason, but the person is just left with some residual pain. I mean, it could be a technically perfect surgery, and it may just be they only got rid of 70% of the pain, or half, and that might, in the patient's eyes, be considered failed. The third is that surgery could be inadequately performed, hardware was malpositioned, or what have you. It could be a bad outcome. The fourth one is not the fault of the surgeon, where it could be the fusion just didn't occur. The surgery was great, but the bones didn't fuse together, and then the hardware takes all the stress and it breaks. It also could be that the outcome was satisfactory initially, but then either scar tissue formed around the nerve roots after a few months to a few years. It could be that the hardware itself is painful, with maybe some soft tissue rubbing over it, or the areas above or below could become degenerative. Here's an example of adjacent segment degeneration. You see some hardware placed on the right and the left, a little cross connector here. The hardware looks fine, but see up here how degenerative this level is? Normally it looks like this, like a rectangle. But here it looks almost like a small triangle. There's actually bone fusing between these levels, so it's really degenerative, and you can see that here from the side. You have a nice open disc space here, but then nothing right there. And that's what it looks like on an MRI. Basically you have disc bulging, degenerative disc, arthritis. All right, so the symptoms of FBSS may include daily back pain, which may radiate into the flank area, into the buttocks, spasms and aching. And the person may also have nerve pinching, which can lead to leg pain and burning, known as sciatica. Treatment options, first and foremost, should be a surgical evaluation. Is a revision for broken hardware or adjacent fractures in order? That just should be the first thing, as a consult with a surgeon. And then if that's not the case, then indications with conservative treatment may include physical therapy, chiropractic. Spinal decompression therapy is a computerized intermittent traction that can help a lot. Acupuncture, medications. Medications may be anything from anti-inflammatories to Tylenol to opiates and more. Now, interventional procedures. Trigger point injections can help a lot with spasms. Injections around one's hardware can help see whether the hardware is in fact causing one's pain. Facet injection or a medial branch block can be very beneficial. An epidural injection can help if there's a nerve root being pinched. That was when steroid is put in around the pinching, and it can soothe it and relieve pain. And then what you see here is a radiofrequency ablation, where a catheter is put in around a painful joint, heated up, and it deadens these sensory nerve endings and relieves pain anywhere from 6 to 24 months. Now, as a last resort, a spinal cord stimulator implant has been a revolutionary treatment for failed back surgery. They've dramatically improved over the last decade. Now they're good for both back pain and leg pain, with over 200 programming options available. Over 3/4 of patients do extremely well with the spinal cord stimulator implant. Keep in mind, this doesn't fix the problem. It's basically going to mask the pain, which can, if you can't fix it, you might as well mask the pain, right? The top non-operative pain management throughout the Chicago greater metro area is with Premier Pain Specialists. There are several clinics accepting over 50 insurances and providing over 25 treatment options. Success rates are very high with the board-certified award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much for watching.